So, dear friends, it is a pleasure for me to welcome you to another edition of the Forum 2000 online chat, where we address the current complicated situation regarding the COVID pandemic and its impact on freedom and democracy around the world. Today we will be looking at Africa because, as it seems, the pandemic is not just a global health crisis, but it is also an opportunity for politicians, authoritarians, different regimes around the world to maybe redraw a little bit the political map of the world, both domestically and internationally. And we will be looking at how that is shaping up in Africa, how things are looking on that continent, where COVID numbers, fortunately, so far, according to the official statistics, remain relatively low, but due to different estimations and also due to WHO estimates, the peak is still about to arrive to Africa. But the impact and the consequences are already starting to be felt very strongly. The economic consequences in particular will probably be very drastic. Much of African economy has gone to a standstill. The remittances from African workers around the world has almost dried up. There is a global decline in commodity prices. So these and some other issues will impact Africa very dramatically, and some economists are predicting this to be the worst year economically for Africa in 3 decades or more. To discuss all that, I would like to welcome with us Andrea Ngombet of Congo-Brazzaville, the Republic of the Congo, a politician, activist, a candidate in the Congolese presidential elections in 2021. So welcome, Andrea, and let's get right into it. So Andrea, how is the Republic of Congo doing in the current health crisis?
We got around 200 positive case in the Republic of Congo. 6 people have been deceased, and so far so good. The population is trying to respect the decision of the government, which is a curfew and some liberty restriction. They can go to school, they can go to work, and there has been some violence against other people from the military apparatus, because every time they got someone outside the house, they beat him and rob him. So there's a kind of mix between security, violence, and the health crisis.
Is there any concerns that the government may be using the pandemic to tighten the screws, to infringe on the liberties, on the freedoms of people?
It's more about for the government itself doesn't know how to manage the crisis, so they are trying to do stuff just to make people more calm, but they know that the risk for them is to be in front of popular violence, people shouting, we don't have anything to eat, how can we stay at home, and you are not providing some health and social security for us. So it's more about confining the people, but don't give them the means to stay at home. So the government is trying to manipulate the opinion on that, but they can't, because it's all the country which is affected this time.
So do you believe there is going to be some explosion of public discontent or anything in that respect?
Yeah, we saw that in one hospital, the staff of the hospital was going on strike because of the COVID crisis, and the population more and more are not respecting the law, because the law said you don't have to go out, and the people just say, if we don't go out, how we gonna eat? And the military people are robbing some businessmen at night because nobody's out, and they break into the shops and they steal. So it's a kind of anarchy which is spreading inside the country. So not just an uprising or violence, but a kind of rotting system going to be more and more spreading in the country. People don't respecting the law. Even the staff and the leadership of the country are trying to flee out because they have double nationality. They want to flee out, going back to their other nationality countries. So it's more kind of desertion of leaderships.
So do you think this will have a serious or more serious political consequences?
I think so. We know that in the coming month of May, we will maybe reach the peak of the crisis, the epidemics, and then we forecast that if one of the big three of the country, the big men of the country, die of COVID, we could see a panic in the leadership, and the regime can change because of that.
Okay. Looking at the wider situation in Africa, how would you assess that? How would you assess the situation on the continent in its entirety?
On the continent, the WHO say that we have 29,000 cases, and we know that the number can't be accurate because of a lack of statistics in many countries, like South Sudan, like DRC or otherwise. So we really think that the number is much higher than that. And we don't have, except the North African zone, like country like Morocco or South Africa, we think that the crisis is gonna hit the country, and we don't have a means to survive.
You are looking in your work quite closely at the activities of China in Africa and the China-Africa relationship in the long term. What is your assessment of the current activity of China, which we have seen over the past weeks to be quite intense? So, how do you view the activity of China in Africa?
China is monitoring very closely the crisis in Africa. We all have seen that Mr. Jack Ma, the Chinese billionaire, sent masks and tests to African countries using the African CDC in Addis Ababa to spread the kit all over Africa. And for the case of Congo-Brazzaville, which I'm really seeing closely, all of the press meeting of the government was with the support of the Chinese ambassador in Congo, Mr. Ma Fulin, and the argument and the word used by the Chinese propaganda was very similar to what the Congolese government was saying. We don't know where the virus is from, maybe it's from America, and they really repeat all the propaganda of China. But more dangerously is the fact that the Chinese traditional medicine, which is sometimes good for something, are more trustable for the country leaderships than other kind of medicine. So we are seeing the pattern of, in the riposte of some African country, the use of Chinese medicine, the use of what they call friendship hospital between Africa and China, are in the front of a riposte to COVID, and also the kind of propaganda we are used to of sending some physicians from Cuba and some medical staff from Russia going to African country, sometimes to help the staff to respond to the COVID crisis. But when they come into the country for the case of a gift of the donation of Jack Ma, they take it for themselves. So the donation arrive in the country, but the people who really need it, the caretaker, the physicians, they don't have the mask and the test. And you see that the drugstore owned by people from the government, they are the ones who are selling the donations. So a French analyst call it the COVID businesses. So the COVID businesses is spreading because of the help of China and the kind of structure of propaganda they have.
What is the let's say reaction of the civil society to this?
The civil society is trying to help, firstly, the most needed in our society, people who really live in the day to day, trying to give some masks, to put some local made masks, also give some food with some charity from the intermediate, like the Catholic Church, like the local church, the local staff, using the local foundation used to, and also the World Food Program, which is very active to help the children, because some children just eat food when they go to school because they have a special care system from the World Food Program. And since school is closed, to feed them is on the behalf of the family, and the family don't have enough money to feed all of the people in the house. So the World Food Program is trying to help.
Essentially, when you were speaking about the role of China and the aid that China was providing to Congo and to other countries, you were saying it's, or as I understood it, it was a lot to basically improve the image of China in the eyes of Africans, of their African partners.
Two things is one, to of course to improve the images of China in front of Africa. We are the best system. We are doing well at managing the crisis, so we can help you. And also the second part of the strategy is a kind of what I can say, the industrial of the drug industry of China is trying to put out some remedy, I don't know the word in English, but some solution for COVID in Africa to test widely a kind of, we got a new medicine, which is our traditional medicine. So you African, you need also to use your traditional medicine to solve the COVID crisis. Don't count on what we call the Western medicine, the modern medicine, the vaccine and all that stuff. So you have this populist argument going all over Africa saying everything which is from Europe is bad and you need to use alternative solutions. And one of the best alternative solutions, of course, is the China medicine system.
If you compare this to the aid or activity shown by Western democracies, by European Union, France, for example, by the US, how would you compare it? Are the Western democracies, for example, helping? Are they efficient in this regard? And how does that compare to China's activities?
They are not doing good, because when it comes to authoritarian regime like Congo, like Djibouti, like Equatorial Guinea, transparency is weakness for them. So knowing that many European, American in New York are dying from COVID, doesn't mean that they are transparent for the public opinion. It means that they are weak and their system is not working. So you see that even if kind of France is trying to help the National Laboratory of Congo, people say that they are not helping us. They are trying just to save their faces. They are not capable to manage in Paris. How can they help us? So you have this kind of propaganda going on.
So you feel it's more a PR issue rather than actual facts on the ground.
Yeah, it's all PR, because the first thing we really lack in an African country is first the food to help people staying at home, water and sanitation to clean the hands, and respect all the gesture we need to respect. And after that, we can talk about health, going in the hospital. And even in the hospital, it's not a matter of breathing system or even mask. Is first the lack of oxygen and medical oxygen in the hospital. So you have a very structural problem before going to know if you are sick or not. And this is a kind of trial of the management, or I may say the lack of management we've seen the past decade in Africa.
Mm-hmm. Different issue, economy. We mentioned it in the beginning. The consequences will probably be very, very serious. How should Africa and the world deal with the fallout from the crisis? Should it be debt relief? Should it be direct aid? What should be done?
Oh, my opinion is we need to have more businesses, because head don't work in Africa. Whenever you send head to government, directly to government, it doesn't work. We need to go, as I mentioned, we need to go first in the structural things. We need to have investment in a sanitation system and really create a business model how a sanitation system can work in Africa, and people paying for that and having the services and being themselves implicated in the system. If it's just aid coming on or debt relief, we will go again in the same vicious circle of heads going on, some big company from Europe, from China, taking the market, doing the work, nobody on the ground knowing how to use that or how to continue the work. The thing will be destroyed, and then again we'll go back at the beginning. So we need more businesses. We need also democracy, of course. We need transparency and maybe some privatization for some goods in the country, like in a country like Djibouti, where you have the biggest base of China in Africa. The people were not able to know if they can cut the traveling between China and Djibouti. So it's a matter of sovereignty for them.
How do you see the longer term consequences for Africa after the pandemic goes away or is gotten under control?
There's two paths. The first is, like you mentioned, the crisis is not under control. Millions are dying, and we will see a very hard government by the more extremist fringe of African people getting power, because they think that the disease comes from abroad, from most cases in Africa come from Europe. So there will be a kind of closeness in Africa, and we fear that they will close the country and the extremists will win. And also we can have another path. The local businesses, the local enterprises, civil society and government can hand to hand and trying to build some local responses. And it's what we are trying to push. In Congo, you will see that the beer maker of Congo, they are trying to now doing some hydroalcoholic solution for the people. We are trying to work with the oil company to help more people in the country. So we need to mobilize also the local industry to make them capable to build some African solution for the COVID crisis. So it means that we need to put the industrial and the political and the civil society together. But what we are seeing actually is people are trying more to look to the politicians, but politicians only, they don't have a solution. We need really to put the local businesses in the loop.
Well, thank you, Andrea. This has been very interesting. I wish you all the best. I wish you that you stay safe and healthy. And I look forward to talking to you physically or virtually again soon. Take care.
Thank you.